Good evening. Now, I've probably been sitting on this for the last 24 hours, something I kind of want to address or bring up. I've talked about this in another video when it comes to neurofibromatosis, where I'm showing you one of my tumors. In fact, you might recognize it from this shit where I shine a light right into it. Let's go ahead and turn this light off real quick too. I'll give you guys a quick scene. So as you can see the veins. That's my tumor. That's one of many. When I say many, I mean many. And I'll show more here in a little bit. I'll do my best to show right here when it comes to this stuff. Now, they'll come in multiple sizes. Let's see if I get this just right. There's this guy here. I've got this guy right here. Let's see here. I know there's more on the back here somewhere. Oh, let's go back over here. So, like, there's this guy right here. A lot of them are going to be in that pea to nickel size and all that that I'm showing you right now. There's another guy right here. And then I got a big guy right here in my cheek. And I'll like I said, I'll show more. I'm going to end up going out of my comfort zone because I'm one of those guys, because of these, I don't like to go swimming without a shirt on. It's not just because of my sexy dad bod and all that stuff. It's because you can noticeably see the tumors when in my body, especially just right, yeah. There's some that I can show you that are larger than this, but then at that point I would probably be going against YouTube guidelines. So we're not doing that part. If you don't know what neurofibromatosis is, there's 3 types. There's NF1, NF2, and then NF3, or aka schwannomatosis. If you don't know what it is, most people don't. A lot of medical people don't even know. It's really hard to find a specialized clinic for it unless you're in the Midwest area. So, like, if you're in places like Missouri, Kansas, Arkansas, Oklahoma, I want to say Illinois, and then there's a couple others. They have the most specialized medical clinics that is specifically for neurofibromatosis in the 3 various forms. NF1 is when you see the people that have all these like tumor-like things growing on their skin. It looks like they're growing on their skin and just underneath the skin. That's NF1. NF2, they're a little bit more different. So NF1, you'll find people, they'll have what's called cafe au lait marks. They look like a weird birthmark. And they'll usually have them all over. People with NF2 will have fewer cafe au lait marks. Let's see here. What's this side? So if I can find where I got it at. Because, yeah, I'm not that super flexible anymore. My back is not the best. Yeah. Like I said, I'm a little self-conscious here. Anyways, all you'd have to do is look up for a cafe au lait mark. It looks, like I said, it looks like a birthmark, but it's not perfectly circular or anything like that. It's almost like a smudge. And can be kind of coffee color, brown, that type of stuff, like a birthmark. With NF2, which I obviously tend to know a little bit more of. NF1 is a little bit more common. NF2 affects like 1 in like 25 to 30,000 people, something like that. And then NF3, it's a little bit more rare. Which it's gonna be more similar to NF2 than NF1. It affects the nervous system. So in NF2, it definitely affects the nervous system. So it grows on your nerves, your nerve endings. And basically, well, anywhere your nervous system grows, it will affect. If they have to go and say, like with this, they can't remove this because the veins that you saw is the artery going through my arm. They risk basically either me bleeding out or losing all feeling, everything else going on in my hand. They probably have better techniques now and all since then, but I'm just not at that point of risking it. All I have to do is squeeze it just right, and I can lose sensation in my hand. The other common thing that you'll see with NF2 is people with it will start to lose their hearing, their eyesight. They will eventually start dealing with various forms of skeletal deformations, mainly in their spine. So I don't like doing this, but if I get just right, you'll see a tumor there. You'll see all these lumps starting to show up. Those are all tumors. So like there's one, actually that's a big fucker right there. That guy goes right along right there. And they're all through my body. I've got them. You'll see them up in here, sorry. And I've got them in my lower spine. There's one right in here. Hard to see. And then I've got these big guys up in here. I might have to show some pictures of some of them, but it's hard to see them under certain lighting. But this side here, I can sit here and go, there's one. Let's swipe down up. There's one, there's two, there's three, there's four, there's five, there's six, seven. And then, of course, I know I've got one right in here, right above the belly button, all that stuff. And they go down on my legs, and they're all like this guy. And people think, oh, it's just fatty tissue. No, that's a benign tumor. And they grow nonstop. This is a genetic thing. There's no cure. The treatment for it is going to be, the type of treatments they have for it is the same type of treatments as they do for cancer. You'll go under gamma knives. You can end up dealing with radiation at times. Both invasive and non-invasive type of surgeries. Painkillers the rest of your life and prescription drugs. So imagine what those are doing to the body too on their own, the type of damages. Now when they go to remove one of these, the way these tumors work, now I got my handy dandy little dry erase board. Please ignore this part right at the moment because I will be touching on that here soon enough. So the way these tumors work, I call them a strawberry tumor, like a strawberry patch. What they're actually are more that of is like a web tumor. So basically you'll have one primary tumor, and then you'll have these other smaller ones, you know, these satellite tumors growing around, and all of them are attached to this primary tumor. And you can have multiples going on. And this mother plant, basically, the mother tumor, is still, you know, reaching out because it's, like I said, it's like a web. So it's kind of like that, you know, it's just like a web. But then you've got these other roots that are coming from that are rooted in. which can then create another tumor at the end. And it's never ending. They'll hit a certain point where they stop, obviously, but every tumor you see in my body is attached to another tumor. So this tumor here, this is what I call my mother tumor in my arm. I also call it Wilson. So this big fucker is attached to this little guy right here. It's attached to this little guy right here. Where's the other one? Because I know there's another one back on my arm. There's another one back here in my forearm that's attached. They're all attached. Now let's say they go to remove this primary tumor. It won't stop these ones from becoming the new mother plant. Just like a strawberry. And just like cancer, if they don't get the whole thing, if any piece of it ends up in your bloodstream, wherever it gets deposited at, it'll grow a new tumor. The problem with this stuff is, with NF2, is you not only have a problem of dealing with loss of hearing, loss of sight, everything varies too. It progresses in stages for each person a little differently. Some faster, some slower. You'll have it where at some points in your life it progresses really fast and then slows down, and then it'll progress fast again and then slow down. Others it's just nonstop. It varies amongst person to person. Where I've gotten lucky compared to many others, it still has rapidly progressed enough that it's begun crippling me. I've begun losing my hearing in my right ear. My eyesight, my right eye isn't the best. My right side up here is getting attacked, where my left side down on this side's getting attacked from all the tumors up in here. I can see her go, like I was doing on the other side, and go, okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and I'm pulling tumors. Like this side's even worse on that, and then one of my legs, it's in my right leg. And I got them in my left as well, but yeah, it's just kind of weird. It's just weird, yeah. But it doesn't just attack the nervous system, which the spinal column is central to your nervous system, just like your brain. And so it'll start to grow in your lower spine, your lower lumbar, and it'll start damaging your the cartilage and all that. It'll start growing in that space right between the vertebrae, and it will damage the cartilage. It'll wrap around it, and at some point it'll start to squeeze your spinal cord, and even sever it and break it. Basically, it'll over time it creates muscular dystrophy. It causes skeletal deformations and so forth, and it all goes to different extremes. It will not only in lower back, you'll find it in the back up here in the neck, and then it'll get up into your brain area. A lot of it is through vestibular tumors, I want to call it, and all that shit, where they'll be in through basically attached to your hearing, your inner earlobe. It'll get up in your brain. So when someone wants to sit there and say neurofibromatosis is no big deal, when they go and look at somebody with brain cancer, go tell them it's no big deal. When somebody says it's no big deal, they're familiar with non-Hodgkin's lymphoma. People know non-Hodgkin's lymphoma is a big deal. It's not some nonchalant thing. And it can turn cancerous real fast. The thing is with NF2, just like these others, you have what would be two ways of developing it. One, you're a carrier. And you end up, well, I guess you could say three. But in my mind, logically, let's say you're not aware of your family history, and as far as you know, nobody in your family has ever had it, and you're the first person to have it or develop it. They would call that most likely a spontaneous mutation, genetic mutation, which does happen. It'll spontaneously develop. They more than likely were a genetic carrier, and something caused that gene to activate, basically, or not activate, I guess, however you want to put it. It affects the Merlin gene, which is like the 22nd, it's like the 20 like something like the 22nd line in your DNA, something like that. So where normal people who are born with that gene, that's the part in your gene, the little spot in your gene, or the line, whatever you want to call it, that limits your body's protein production of what causes tumor growth. So your body is genetically programmed to limit how much proteins it's producing that basically turn to cancer, or can turn into cancer. I don't have that. I don't have the gene that limits tumor growth in the body, and so my body produces this protein that allows it to constantly grow these motherfuckers. Usually, the way people find out that they have it is, well, like I said, either they're related to somebody and it either developed as a child or at some point in their lifetime. A lot of times it'll start showing up, usually, for most people, usually in their late teens into early 20s. That's when it started developing for me and started showing up. But you still have people where it'll develop basically right away after, shortly after birth. You have, and all that stuff, which for them, they end up, obviously the medical shit happens sooner for them. So it's where you see some of them where they're deaf, they're blind, or they're starting to go blind, or starting to go deaf, however, which one goes first. They've already had numerous amounts of surgeries and all that. If I had proper medical coverage, which I don't, I would be in getting surgeries every 3 to 6 months. I would be in getting x-rays and MRIs and CT scans and all this shit every 6 months to monitor tumor growth throughout my body. So the other way that people end up finding out that they have it, which is kind of two ways on its own, but is they will, like myself, they'll start growing these tumors. And it's usually the first tumor, and a lot of times it's like, you get it's just fatty tissue, but then more start growing. You're going, okay, calcium deposits, no, it's not that. Then you have those, they end up finding out because they had a seizure. And that's how my brother found out. My brother was the first to be in our family, between my dad and myself and him. He was the first to be diagnosed with it. My dad had him, and not long after he came back from Vietnam. He had to deal with the Agent Orange shit. That's where we actually believe that's where it developed from. That's what caused that spontaneous mutation within the genetics. My dad was obviously a carrier at some point, but yeah, he didn't show anything at all until, I guess his mid towards late 20s, something like that. About the same age as my brother when he got diagnosed. For him, he started having seizures, and when they would do the scans and the testing, he wasn't testing it positive for cancer. He wasn't showing any tumors in the brain cavity at first, and it took, I want to say, about a year of this going on before something finally showed up in the scans. Neurofibromatosis type 2, type 1, type 3 is benign. It is not a cancer, but it grows and functions and affects the body just like cancer. If it deposits in the lungs, it can grow in your lung and eventually shut down your lungs, just like lung cancer. If it gets into your kidneys and your liver, shut them down. So, like, there he is. This guy right here. And then I've got a couple more on this side. Another one there. And these ones are the worst. Oh, see? That's not my ribs. Those are tumors. See those? This guy right here. Right here. This big fucker right here. Those are all near my kidneys and my liver, all that shit. You know, in those regions. Those were to reach in there. You shut them down. I had to go through surgery. They had to treat it just like cancer. So when certain people out there say, oh, it's not a big deal. It's not serious. These are people who are, for most part, perfectly healthy. Don't have anything to worry about other than their own alcoholic addictions, most likely. They get to deal with the health factors from things that they did to themselves versus things that they're born with. You know, some of you are sitting here as I'm smoking, you know, I know some of you want to try and call me out on this, but I'm going to get to this part too. Now, there is a shit ton of information, surprisingly, online out there for people to look up to be able to see this stuff more directly, to be able to get more in-depth information. I do suggest the NF Foundation, the Children's Tumor, was it the Children's Tumor Foundation also, or clinic? Dornbeckers has good information here in Oregon. OHSU has some of that information too. They have a clinic up there. It's the only place I can go to in Oregon that has a specialized clinic, even though some of those doctors still don't really know how to treat it or what it is, because you really can't treat it any other way. Other than the way you would cancer. Imagine being somebody who has something that's not curable, and they know it's going to kill them. They know that they're not going to have the life that they see other people have. You know, some of us would rather be dealing with actual cancer than neurofibromatosis, because at least we know either we're going to die faster and not have to keep dealing with the suffering and having to hide it, because people don't give a shit. They're just so complacent, and they have a habit of minimizing serious things because they actually don't know what the fuck it is, and they don't take the time to really look into it. This is where I can have fun with this guy. Hopefully you can see this. It's set 0 to 100. Quartered it, 25, 50, 75. Did it as years. So you got 100 years here. You know there's people that's reached beyond 100 years old. Very few. It's like 1 out of 1,000,000 maybe. I don't know the statistic on that one. I haven't, yeah. But I'm just throwing that out. But the average life expectancy is, it's actually like 77.28 is when I looked it up, but I rounded up to 77.3 years. That's your average life expectancy. So where that line is, right here, that's roughly about where it's at. Now, when we look at this scale, on average, about it's more than 40%, so let's just say between 40 and 50% of people with NF2 will never see that age. They are guaranteed, all of them are guaranteed, if they make it past a certain age, which we're going to get to, So I'm going to write up the scribble or erase the part where it says life expectancy underneath. The max they're going to reach is 70. And most people sit back, oh, that's not a big deal. That's 70. You know, they've had a full life. You know, that type of thing. That's if all of them were to get past a certain age level. The average is about 1 in 2. Will only see the age of 50. I'm 43 right now. I've made it very clear because I do know how my progression is on my situation. I will be lucky to see 60. I will never see the age of my parents. So when somebody says neurofibromatosis in any form, NF1, NF2, because we're not taking in other factors where this is concerned, because there's the psychological factors that this disorder has on you mentally, and the constant battle of waking up every fucking day in pain. And no matter what, you have to push yourself. Excuse me. And you know you have your limits. And when you get to a certain point, you are not willing to push past your limits. But people are going to continue to disregard your limits because they seem to think that because they're perfectly healthy, you can do it too. They're not taking in consideration of the fact, and this is how I'm going to do this. I'm going to do this in a wave to start on one side, on the top side, or kind of a, you'll see, like a Ronald McDonald sign, just repeated. So that top part's representing the average life that that half of people with NF2 or I'll just say neurofibromatosis just to keep it easy. That's the life expectancy they're generally going to have. About 50% of them are going to be lucky to see past the age of 50. When you look at the average between 70 and 50, what do you think that's going to be at 60? The average person with NF2 is going to see 6, and people are going, oh, that's a full life. That's a full life. This is coming from people. Now, instead of doing the rounded edges, I'm going to do the... It's going to look like a W, basically. A bunch of W's or teeth on the bottom part of it. Actually, I'm going to just go solid. Just color it in, basically. All the way to the average life expectancy. And the thing is, most of you people out there who are healthy, who are acting this way, so long as you don't become a fucking drunk and ruin your body more, so long as you don't get into drugs, so long as you're careful, doing your best to be a careful driver, you can only do so much where other people are concerned. So long as you're being healthy, eating healthy, drinking healthy, doing all this shit, being a healthy person, actively healthy and all that, you can live beyond the average life expectancy. So while people out here who got to enjoy all this life, they want to talk about how somebody who only gets here got to have a full life. Really? What about the next 7.3 years? They lose 30 fucking years, basically, of life that any people and some of you folks out there want to say, oh, this isn't serious. Neurofibromatosis isn't serious. You only lose 3 decades of your life. the time span that it takes to have a child, raise a child, and have a grandchild, technically. And some people are like, what? Wait a minute. How's that? Well, start out soon enough, you become a grandparent soon enough. When you look at the history of humans, people having children after they're 18 is technically considerably relatively new in human history compared to those having kids at 15 or younger. That I don't necessarily condone. I was a teen parent. My son was born 10 days before my 15th birthday. I had to learn a hard lesson from that alone, and I don't blame that on him. I blame that on myself. And to some degree, I also blame that on things that I didn't know about at the time. Between my child being born just a couple years before my NF started developing, the fact that I was growing up on spectrum and not knowing, so I was having to deal with a lot of internal battles at the same time. Social battles, everything. I didn't want to run from my child, and I didn't. I had my child withheld from me. I raised my younger son with minimal help after his mom left me in some weird coma-type state in the hospital, and I ended up having to put my health to the side, and it's not like I'm not putting it on my child, but that's what I knew I had to do. I had to put my health to the side so I'd go back to work and be able to do more for my son than what I could have done just off of $655 a month from disability at the time. I couldn't pay bills and provide for my child. I went back to work, and after a while I started working 2 jobs because I knew I could only go so long. I knew my health was not getting better, and I worked my fucking ass off. I had to work through the pain. I had to work through my spine, everything, the way it's damaged. My neck up in here, which I've shown on another vid, which I think it's not public. It might be unlocked. Showing the damage up here. Plenty of people have seen like even Elon Musk and others where they want to go in through here, and they want to go in and sort of fuse your the vertebrae in your neck, or that type of stuff. For myself, they want to go more extreme because of the damage just as in this section. They want to fuse my lower spine. My mid spine, I still gotta find out the results of the other. I get a call because I'm kind of afraid of that one, because half the time I feel like I'm literally being sawed in half. Where my neck's concerned, from like C2 or something like that down to like C7, I think it is, or 3 to 7, something like that. They want to go through here. They want to move the artery, go around the artery to get to, and then of course, basically between the artery, they want to go past my artery. They want to get to the vertebrae from 3 to 7. They want to remove those. They don't want to, they're going to remove them. They want to cut them out. And when they go to remove them, they have to be careful not to touch the spinal cord. It's like a little water balloon. It doesn't take much. Once it's popped, it's done. You're paralyzed from that point on. And then they want to put in cadaver bones and then fuse my neck. Each scenario raises my chances of death on the table higher and higher. By the time they get to that, I have about a 70 to 80% chance of dying on the table. There's a reason why I do not want to take certain risks. Because of that, whether my kids hate me or not, I want them to still have that. I still want to be able to live long enough to give them the opportunity to at least have some part of my life again. Those have been following these vids for a while, this channel. There's very private things that I've talked about before on here that I now keep things that's private or unlisted, where it has to do with my children, my relationships, my family, and all that stuff. Those who follow long enough, have followed or watched long enough, know And I don't really want to go into that on this video because it's really not about that. But I am going to get a little personal to this, but I'm trying to address something, little and someone to a degree, while educating people in a way that it might actually like sink in a little bit for them, because I've been quite the twat towards myself where it comes to my NF2, and I'm not talking about my ex, basically my son's mom, whatever. So I get a phone call about my son having a seizure here this week, or this last weekend. And yeah, I'm aware that there's certain things that can cause the seizures to happen, even if you're not epileptic, between stress, not eating right, drinking too much, drugs. It can be a list of things. And another tumor right there. But I thought about those things, but I also taken to consider into that concept that how my brother found out, and then how my family ended up basically. Yeah, the average statistics for people with NF2 for it to be passed on. Let's say you've got your two parents, one of them has it, and there's two kids. Statistically, one of them's going to have it. If you've got three kids, it generally, statistically, more than likely, only one of them's going to have it. That is the legit statistics of that. I can pull that up if need be. Because there's some people out there who made a profession in the medical field who's quite an ignorant, arrogant human being. They're stupid. They obviously didn't take their job serious enough. They just... Yeah. They didn't give a shit about the people. They didn't give a shit about anybody in that office space. All they cared about was their paycheck. Miss disbelief. Like I said, it took my brother from his first seizure about a year for the tumor in the brain area to start showing up. So when I hear that about my son, it's like, I definitely understand his mom's perspective. The fact that she didn't even find out till like 3-4 days later. After that, her mom got to find out first, because her mom seems to think that her and I slept together, and that I got her pregnant. She gave birth to my son. And even my son's in his brain sort of seems to think that way. And when that person because I got to hear about this, I don't blame my child's mom being upset with her mother for not notifying her and letting her know, or at least calling to make sure whether or not she found out about whether or not she knew about our child that happening to him. The way that person handled it, she laughed at my child's mother. I thought you already knew about it. It's no big deal, that type of thing. Let's come back to life expectancy, because I have a very hard temptation of not giving in to wanting to say that lady's name outright. While you sit and laugh and say it's no big deal, he's in a position, his wife at least, because I know they both watch this stuff, they need to keep an eye on this. Because I'm going to show you something on here that should sort of kick in for you. See, she was born in 63, 64, something like that. So she's already like 60, 61. She's already hit the age that I will be lucky to see. So I'm just going to put GM on it. Specific people understand what that is. That's about where that person is living at right now. That's their age. And so long as their alcoholism doesn't take them down rather quickly, because I watched what that does. I had an uncle end up with ended up with stomach cancer and a tumor the size of a fucking basketball, which killed him from being an alcoholic. I will drink, but I just, I don't know how long ago I did the hot cocoa vids. That's how much I've drank in that time period. And about that much of it, so from basically where the top of the label is, that went into my awesome hot cocoa cup. About the equivalent of a shot or two. I don't mind drinking once in a while. I don't have a big bias on people who drink. I have a problem with alcoholism because I've seen what it does. I saw not only what it does to a person, I see what it does to a family. But when someone like that wants to sit there and laugh, and they think that NF is no big deal, my child, in a year from now, if these seizures were to continue, and in a year from now was to finally end up finding out and realize and ends up not only developing the NF, so people know, my older son, right, is 27 years old. That's right about the same time my older brother found out, ended up having his seizures. Right in there, started to have his seizures. And about a year later, it was when the tumor started showing up, and that's when and then they ended up testing him for the NF, and they found it and all that stuff in his genes. Granted, my brother is past 50, or he's born in 72. He's 8 years old. No, he's 50 now. He's 50 now. He survived brain cancer, but it's tumor had come back more than once. He's had to deal with it a couple times. He barely survived. On that first occasion after that, he's done pretty good, but the problem with that is each time they go to remove something, what are they doing? They're removing a chunk of your brain. Does this twat want to see that happening to that young man? And has some of his memory literally being cut out because she wants to laugh and thinks neurofibromatosis is not a big deal. It ends up him developing that. His clock starts ticking then. And I'm going to get to that. So while that woman lasts, and she knows so long as her alcoholism doesn't take her out, she's going to get to most likely reach that 70 plus years of age. While she laughs because of someone like me, because she hates me that much. She hates disabled people. She hates anybody who collects off the system, all this shit. And she embrazened those beliefs into my child. And there is a backstory to that, which I won't get into that. But I'm more concerned about his health, whether he likes me or not, all this shit. I am concerned about my son. So while she sits and laughs, like it's no big deal. Does she like the idea that the average life expectancy after somebody has been diagnosed with NF2 is about 15 years from that diagnosis? That's the average. Think about that for a minute, lady. It's no big deal. He's 27. It puts him at around 42. What it's most likely is going to put him at is he's going to be in my shoes. Even though I started developing the tumors, the neurofibromatosis, 10 years beforehand. So I should have already been knocked out by the time I was 40. So I recognize that situation. That I've gotten lucky. But I am still losing my hearing. I still deal with that whole tinnitus bullshit in my right ear. It's starting in my left. I'm having more and more trouble hearing people talk to me. So long as they're in my left ear, I can hear them better. My eyesight, my right eye is starting to go bad. And I'm right side dominant. So, yeah. Here's somebody who writes with your right hand. You're going to have to relearn how to write with your left hand. So, if that person thinks this shit's not a big deal and thinks it's funny, right now at the moment, he's got about more than a 50-50 chance. It's like I said, if you got 2 kids, one of your parents has it, one of your kids is going to get it. It's going to develop. The fact that my oldest brother, it's now developing in him, that's all 3 of my mom and dad's children that has neurofibromatosis type 2. That is a 100% genetic inheritance that we all developed it. Not a 50%, not a 35%. That was a 100%. When it comes to medical statistics, that'll tell you that my children don't have a 50-50 between the 2 of them. They're in the 70 to 80% range. They're very likely going to develop it. Both of them. And if it skips one of them, it will develop in my grandchild. It will be developed. There's no changing it. Unless there's a place like Gattaca where you can go in and you can have designer babies implanted into you, where when they're born, they'll never have any form of cancer. They'll never develop an addictive personality. They'll never have this or a heart murmur. Heck, they won't even have a nose-picking habit. It's not going to happen in this lifetime. The only hope really that people with NF have at the given moment right now, especially those who are starting to lose their ability to walk, they're going crippled, they're losing their eyesight and all that stuff. There's the technology in the current day right now that I see right now that gives some level of hope is the Neuralink that Elon has been making, or it has created, or that company has created. Am I gonna go out and get one myself? Because of my religious beliefs and my faith, I don't think so. Yet at the same time, there's that part of me because of all the shit that's gone on, from this human being constantly judging me, to that person judging me, to my younger son judging me because he's been influenced through those by one of them, through and so forth, and all these others judging myself. And I know other people with neurofibromatosis are going through the same struggles, because people look at you and go, "Oh, but you look fine. Do you have x-ray vision? Are you sleeping in my sock drawer?" Or anybody else's that are going through this. Because everybody with this it develops at different paces for almost for each person. My dad, it's now starting to get bad for him. It's now starting to affect him, where his hands start to lock up and do this all weird shit. And like my hands, if he's had to do it, I have to do it at times, where my fingers will start to bend backwards. And there's nothing I can do but grab a hold of my fingers and force them this way. Because the nerve damage that these tumors are starting to do. But hey, it's not a big deal. Because after all, when a grandmother has the full opportunity to get to live a full life and thinks it's funny and not a big deal, that something that even her own grandchild does carry in his genetics. Now, whether it's developing or not right now, we don't know. We'll see what happens. And I hope they're paying attention. Because I am concerned. I do not wish what I've had to go through on either my children or anybody else. And I also don't wish what I've watched other people with this disorder have to go through, because there are some right now that didn't get to see 30. There are people that I've known within the neurofibromatosis community from the groups that I've been a part of that they didn't get to see 25. They didn't get to see my children's age. My younger son is now 24. My older son is, going on 27 now. He was born in 97. 25. He's going on 26. How can you look at something that takes and shortens your life and removes, on average, at rounded, that much of your life erased, not be serious? I will be lucky to see this. She will already pass it. My parents are already past that. This is why I got to a certain point in my life where I started to speak up. Because, yes, a part of me feels that there's an urgency in my life that I don't have the time in my life to do the things that I should have been able to do 5-10 years ago. And if I didn't have my attention dealing with other bullshit for the last half decade, at the minimum, there would have been a lot more things done. I'd probably be a little bit further than I am now. And that's why I treat this seriously, because I know I don't have that time that person has. And since she seems to think I fucked her and got her pregnant and she gave birth to my son, and she thinks this shit's funny and not serious, then maybe she needs to think about since, like I said, she seems to think I fucked her, since her and my son more than likely it has this and it's developing. She gonna laugh at him when he starts going crippled? She gonna laugh at him when he starts suffering on a daily basis and tells him to suck it up? She gonna laugh at him and tell him it's no big deal? She gonna start treating him like shit too when he starts finding that he's gonna when he starts hitting to a certain age where he can't do the things that he used to? And at most people, when they get to a certain age, you can't always do the things you used to. That's a given. There's the age factor. But when you got something that will rapidly start destroying your body, is that really that funny? Is that really something that you treat like it's no big deal? When you look to historical people, when you go to the severities of where NF2 is concerned, you can look to people like the Elephant Man. He had neurofibromatosis. You see that same thing on the Learning Channel a lot when it comes like the Dr. Pimple Popper. She's dealt with a lot of neurofibromatosis, 1 and 2 patients on that show. I don't like that show because that shit's disgusting. But I know she's been on there. There's been some other ones that you see that, where you see these doctors, or not doctors, but these different patients from other countries that are having to go into the cities because they got this big, massive growth on their head that's deformed them. No, neurofibromatosis is not a big deal, right? And some of those people only took a few years for that to happen. Imagine the amount of pain it causes when even the bones in a person's body is being deformed because of something growing, and if you don't have the right medical coverage, yeah. I've been lucky to a certain extent that it didn't cause severe deformations to my body. But there's also a reason why when you watch me talk, you'll see part of my face when I talk, only one side of my mouth moves more than the other side. You'll see one side of my face droop a little bit more. I very much tend to already have somewhat of an expressionless face. And at times I have to put on, expressions to what I'm talking about. Other times it just comes naturally and all that stuff. But when you start paying attention to that, is that what you want? Does a grandparent seriously think that their grandchild at any stage of risk, that's no big deal? That kind of life-crippling situation. I'm actually pretty disgusted by that person. No amount of money and success will make up for how fucked up of a heart they have, because they're even disregarding their own grandchild and the risk that his life is in and the situation. What kind of changes that is? Is his wife prepared that if it gets to a certain point where he may have to deal with some, if this is to develop and this turns into this type of thing, is she willing to be ready to have to work her ass off to care for him, herself, and their family if he's not able to do it? Or is she gonna do what was basically advised to my son's mother, and that's basically leave me in the dirt because I'm a lazy son of a bitch, because I live in severe fucking pain on a daily and you don't see it. You don't see me waking up in the pain I'm going through every day. In these vids, you don't see that my spine is, I feel like I'm being cut in half. So right about where this chair is here, that you can see, in my spine and about that level, I feel like I've got a saw going into my spine and cutting me in half. You don't see a lot of that shit. Why? Because I had to grow up living with this pain, and your tolerance gets up higher and higher and higher as you get older. People out there with MS who deal with chronic muscle pain, stuff like that, I think they can relate to it. They hurt a lot, and they'll have days that it's really bad and it takes them down, but otherwise they get up, they still get up, they move about, and they do the best they can each day, you know, even when they're hurting. And a lot of times people won't know that they're in pain. So I want not only people to kind of learn about this in this degree, this is kind of a level of awareness. I'm not going into detail of this disorder necessarily. I gave you kind of enough. I showed you enough. When someone like this is more than likely to make it still halfway to 100 from where they're at and still get up into this range in life expectancy while they laugh and think that something like this is no big deal, they need to come to the realization that their grandchild, whom they do love very much, and I recognize that, because their grandchild has her wrapped around their finger. That child develops this, he's not gonna see. He's gonna be lucky to see the age that she is right now, and she thinks that's funny. Think about the amount of life that young man's gonna lose, an opportunity of things that he could still, opportunity of the numerous experiences that he could still have in that age grouping. What's the average age that Americans retire these days? It used to be like 55. It's like 65 now. Think about that. You know, you're looking at 60, 65, her age. So by the time he gets to retirement age, he has a possibility of being taken out by this. I will be lucky to reach that age. My dad has been a champion in the family. And at first, there was a long period of time there. He just kind of, even though he has it, he wasn't, and dealing with some of the tumors that he was still too, he wasn't dealing with it in such a severity that it was crippling him or taking him down. He just, if he needed something, he would just go get it removed. But it finally got to a certain point, though. It's started to medically affect him about a year or two ago. So he got lucky that it progressed much slower for him to get to the more serious stages, to where basically, by the time it was to really do anything, by the time it in essence was to reach where I'm at right now, he's probably, might as well say, about 10, 15 years behind me. Because the things he's starting to deal with now is what I was dealing with around between 30 and 35, somewhere in there. I was already dealing with it. Um, and it just doesn't get better. um, so long as he's careful and all, he's gonna live his entire life. He will live his entire life. There's other things factor-wise that worry me, but again, that's not what this is really about. I'm trying not only to inform, educate a little bit on this, but also kind of address somebody a little bit on their bullshit. About a little more than half of the people who have neurofibromatosis type 2 are on spectrum also, and I'm going to show you. And again, actually, now I think about it, so I can bring this up and show you guys. What's that say right up in there? See that? Average life expectancy, 15 years from diagnosis. I'll read it out. It is estimated that a likely median survival time for patients with NF2 was approximately 15 years following diagnosis. They also estimated that more than 40% of patients would be expected to die by the age of 50. Is that funny, Grandma? And that all patients, 100% of them, will die by 70 years old. Even losing a decade of your life is not okay. If it's something that you caused yourself, that's on you, not something you're born with. Now, why am I not so big on the? Why am I not freaking out on this? Because my NF is going to kill me before this. This is still something I have been mentally I've been mentally pushing myself here lately, preparing myself that once the New Year's begins, I can start weaning and hopefully quit this next year smoking. I'm not going to be one of those idiots who goes, oh, I'm quitting on New Year's and start back or never even try. I'm doing things a little different because I know myself. Other than that, for most part, diet-wise, I eat pretty good. This and this are the worst things I fucking do. Now, I'm going to pull up some other shit. So you'll find, like, those with NF1, a lot of kids, a large number with NF1 are going to be on spectrum or have autism. Those with NF2, it's going to be, well, I'm going to see if I can find the image for it. So it makes it, there we go. So, this, let's see here. I'm going to get it to where I can enlarge it so you guys can see it easier. So, one, there's the neurotypical brain. There's your autistic brain. You see the firing, how the brain fires off? Well, when you look, it's neurofibromatosis. Now, when it comes to this, I'm going to talk about genetics. And it breaks it down. when you go to look into this, you can start, eventually, the more you start going into the genetics and start looking it up, you'll end up learning that if you have more than 2 children, one of your children is going to develop it, the other one generally don't. They become just a carrier. And then at that point, between your 2 kids, even if the one who did develop it has kids, their kids may not develop it and become carriers, where the other child who didn't develop it and is a carrier, their child may develop it. So it's not something that's like straight up planned or whatever. It's easy to figure out. But was that the one that I was looking for? This one? Nope. But anyways, you can start going through it. I'm having trouble finding some because NF1, NF2 information will overlap. So, what's funny is this is still connected to my projector, so it's probably showing up on my wall out there. But when I'm getting phone calls hearing about my son and everything like this, I do have concerns. And when I'm hearing how things were handled, it's showing that it's not only a lack of knowledge and education on the part of, and I don't blame this on my son, but it on his part, because he was brainwashed by the grandma to think that it's no big deal, amongst other bullshit. There's been some bullshit, and I'm not happy with it, obviously. But to see how that scenario was handled, and then to hear that she laughed at my child's mother, like, well, I thought you already knew, ha ha ha. Like, it's no big deal. Oh, it's just probably heat stroke or stress, that type of thing. When you have family who has a genetic disorder that is deadly and can turn cancerous at any moment, because one day you could be doing fine, and the next day all of a sudden, a tumor may be growing in a spot that you don't know it's growing there, because obviously you can't look at yourself and go, okay, well, there's one there. There's got to be one, like, you can't see inside yourself. You can only see what you can see and feel what you can feel. And there are tumors in my body that are deep enough I can't touch them or feel them. And you won't know if it's turned cancerous till it starts to affect you that way. You may not even know that there's a tumor there because it's small enough that it doesn't show. And it's not solid enough to show. Until it gets big enough to do so. And until that point, it will affect that person until that shows and it gets treated. So having the knowledge of knowing that you've got family that's going, okay, my family's doing this is a very strong chance. Does it mean that's what it is? No. But the likelihood is up there, and so to throw caution to the wind says you might as well be one drunk son of a bitch, go fly a fucking airplane with no piloting experience, because that's what you're doing. You're flying blind. Drunk. And stupid. And when there's somebody that was a medical professional to treat something like this as if it's not serious, shows their arrogance, their ignorance, and their lack of knowledge of it. Because when full-blown medical doctors who are not just head nurses are not aware of this disease until they start doing homework and realize, wait a minute, this is not good, this is deadly, this is serious, it tells me a lot about that person. I've already figured out what kind of person that is, and I just don't have a lot of very nice things to say right now. Neurofibromatosis type 1, 2, or 3 is not something that you just laugh at or you treat lightly. You don't treat non-Hodgkin's this way. You don't treat cancer this way. You don't treat any other disease or disorder this way. And the only people who do are heartless twats that don't give a fuck unless it's something that starts to affect them directly. Or it affects somebody they care about. And even then I start to question. Because when they couldn't even... Their brain could not even put two and two together to go, wait a minute, you know, it's possible my grandchild could be dealing with this and we need to at least know. Instead of laughing about it because, you know, you think you're just, you know, too strong for that. Shows how stupid you're being. Shows how little you actually know. When somebody who's genetically has had their ability to live a genuine full life is not 50. It's not 60. When your average life at this point is hitting closer to that of 80, that is a full life. A full life is one that isn't taken away by cancers. It's not taken away by genetic disorders. It's not being taken away by shit like that. By things you can't control. Now, if you choose to be a drunk, you choose to be a fucking serious drug addict, and I'm not talking pot. My brother's dead at 30 because of drugs. My sister Heather's dead because she ate herself to death. But that wasn't serious, right? It just took their life. Yeah. Before they were 40. This is how disgusted I am with some people. When they don't realize that, you know, if something was no big deal, people wouldn't lose their lives over it. People wouldn't lose their abilities to walk. People wouldn't lose their ability to fucking do what they normally would do before the age aspect does its part. A full normal life doesn't involve living in serious pain day in and day out with very few good days. I can't help but call that person a heartless bitch. What you did with your life, the choices you made with your life, and how you fucking led it is your fucking problem. You hurt a lot of people. But when you're disregarding even your own grandchild at this point and the level of risk that he's at of developing this and what it can do to him, you need to get some fucking help. Or you need to pull your head out of your ass because you're not going to treat my child the way you treated your fucking husband when you saw that medical bill. Hate me all you want. My child can hate me all he wants. I do not want to see him go through what I've had to go through. I don't want him to see his life be shortened by something that he was born with and have to deal with people like his grandmother judging him the way him and his grandmother judged me. Anyways, I was going to throw up some pictures. I'm not going to... I think I've covered enough and showed enough. And I think people should be adult enough to start looking this shit up themselves, too. For those who are not aware of this stuff and this is new to you and obviously not related, you're not related to me type thing, and you get curious, yeah, look up the neurofibromatosis NF Foundation, CTF. There's a list of them. You can look up the different ones. John Hopkins, all of them. They'll have information on this and more in depth. This is one of those things that they actually know more about autism than they do about neurofibromatosis. And those who are aware that it's only been in the last 20 years have they come to really start understanding to a degree of autism. Because when I was a kid back in the 80s, they, unless it was something blatant, somebody with Down syndrome or had severe autism, they didn't have the knowledge then really to be able to catch it in others. There's entire generations of people who've gone their whole lives not knowing that they were on the spectrum, and it ruined their life. Because just like with neurofibromatosis, if the disease, or I should say the disorder, doesn't kill them first, depression and suicide could come in behind it. Most people on spectrum usually don't live past 50 because they end up killing themselves because of the way people treat them, the way their friends and family treat them, and the way strangers treat them. Then you throw in the neurofibromatosis aspect in this situation. And if that doesn't kill them first, there's a good chance that the depression could end up killing them. Especially if they get treated the way I was. And the way others who are in my shoes have been treated. To have to try to explain something to a doctor that does not know about this disorder well enough, and they want to hand you an ibuprofen and say, here, this will help. It's time that these medical professionals start really taking the time and learning about some of this stuff, even if it's at minimum, so that they're at least aware. You know, not every doctor's going to have every, disease, virus, genetic disorder, any of it, all of it in the top of their head, in every aspect of knowledge of it. But they're going to have enough knowledge in their head that they're going to be aware of these things. And they need to become more aware of it. We can sit back and watch people dealing with the same exact disorder, see them in somewhat of a, where we can see the physical, when it presents itself in such a physical way, it's hard to deny it. People show concern, but when it comes to those that you can't really see it, and you show no concern, are you going to treat people with cancer that way? Because you can't see it. Thanks for watching, and I hope you all have a good day, good night. Be safe out there, and start growing a fucking heart, people. It's one thing to be a skeptic. It's another thing to go around projecting your own self-bullshit onto everyone and calling everyone else a fucking liar. There's some things you don't want to be proven wrong on in a way that it could affect you. And in this case, I don't want this to affect my son. But I also have enough concern and enough, I don't know what you want to call it, smarts, empathy, whatever, concern, however, that I want to make sure that my son, because I know he watches this, and I know his other half watches this stuff. His mom watches this stuff. They at least keep an eye on this shit and educate themselves. Because if he ends up developing this, he's going to know what it's like to be in my shoes, and he's going to be eating his own words and his grandmother's words. Excuse me, because her and even his mom taught him a lot of shit, a lot of bad shit. His mom had to get her eyes opened up a bit too. Since being back in the picture all those years after a while, she saw what it did to me. She watched it cripple me. I have a wheelchair for those random occasions I end up losing my legs. But But there's a grandmother out there who thinks it's no big deal to lose your legs and, wake up one morning and be like, why can't I use my fucking legs? Does she care about what what that would do to her grandchild if he has to go through that? Because he was taught that this was no big deal, and may end up finding himself in a situation that, if he is developing this, I don't want him to find himself in a situation where he's caught with his pants down. Later.